Hello, today is December 8th, 2023. My name is Dorian Williams Jr., and I'm interviewing Laura Garcia today for the Voces Oral History Center at the University of Texas at Austin. Please know that this is a recorded interview that will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. So if there's anything you don't want to talk about or answer, I would definitely honor those wishes. Also, if there is something you want to talk about, please bring it up and we can certainly talk about that. Just a few housekeeping things. Because we're not conducting this interview in person, I do need to record you consenting. So I'll ask you a series of 5 questions. You can just please say, yes, I agree, or no, I do not. So for the context of the first few, Voces wishes to archive your interview along with any other photographs or documentation that you share at the Benson Library at UT. We will retain copyright of the interview and any other materials you donate to Voces. So that being said, do you give Voces consent to archive this interview and your materials at the Benson Library?
I do.
Awesome. Following up, do you grant Voces copyright over the interview and any material that you may provide?
Yes, I do.
Cool. So for the next couple of questions, before we get started, we do have a pre-interview form that we've already filled out. We'll use that information to help with research. The entire form is kept in a secure server. Before we send it to the Benson, we would have stripped out any contact information for yourself or your family members, so that won't be a part of your public file. And the public file will only be accessible at the Benson Library. So that being said, do you wish for us to share the rest of your interview in a public file and make it available to researchers at the Benson?
Yes.
Great. And then lastly, Voces does receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. So would you give consent for us to share your phone number and or email with the journalists?
Yes.
Great. Well, that being said, we can go ahead and get started, Laura. So I always like to start just with background. Obviously, very decorated career. So we just like to kind of hear where you are now and how you got there from a work standpoint. So can you tell us a little bit about what you do now, and then maybe just something briefly about your journey as a journalist?
Yeah. So I am the afternoon evening news editor at the Texas Tribune, and I've been here just over a year. And I sort of credit getting introduced and getting this job with having produced a major series on COVID and at the San Antonio Express News. So I was a business of healthcare journalist over there for a few years. And before that, I was in Victoria, Texas, working at the daily newspaper as a reporter and editor in healthcare and nonprofits. And I graduated from Texas State University, and I traveled around with doing internships and such, and now I'm here.
Fantastic. And the Texas State mascot is the Bobcats, correct?
Bobcats. Yep.
Awesome. Go Bobcats. Cool. So you sort of mentioned your work on COVID, and I think that's a perfect transition to kind of just get us started for the interview. I'm sure that at this point, you, like a lot of people, are just tired of talking about it, but it is such a pivotal part of, I think, just our of global history, that it's definitely worth being studied, like in this case. So I'm just curious, March 2020 rolls around and the news of this virus starts to creep in to the news outlets. Like, where were you at that time work-wise? And how do you remember that experience of COVID sort of becoming and starting to be a thing, and how you handled that from the work standpoint?
So because I was a healthcare reporter, I had actually heard about it a little bit in January and February, and just kind of heard about this virus that was happening over in China, and that it was pretty serious, but it was not something that was like on the front page, or, it was just something that it was my peripheral. And then there was the cruise ship that needed to dock somewhere, needed to come somewhere, and all those folks ended up coming to San Antonio first in the States. So which was interesting, because all of a sudden the first folks that we believe to have COVID, or were exposed to COVID, are here on the base here in San Antonio, Texas. But so we covered that as much as we could. And then there was a case in which they let somebody who was exposed, they cleared them. They went to one of the most populated malls that we have, North Star Mall here in San Antonio. Um, and then they got called back saying, no, wait, you were not supposed to be cleared. You actually are still positive and could be contagious. And at this time, I want to say it was late February, early March, and it was so it was pretty scary, and my editor's like, well, we have no idea anything about this, but go ahead and go to the mall and try to talk to people. And I'm like, should I be wearing a mask? Like, am I putting myself in danger here? We just didn't know, and so I did it because that's my job, and talk to people. And of course I'm talking to people. We don't know. It was interesting because I'm watching them sort of clean all the surfaces she was in the food court area, this woman. And so I'm like, I'm watching them clean. I'm like, that is not gonna work. You know what I mean? Like with their, just like a rag with like some, little, I'm like, that is not gonna help with the virus, but yeah, it was interesting, and I got to talk to people very early on about it as we're all kind of figuring it out. And so as soon as things started happening, and there were more folks in the country that were contracting COVID-19, I stayed on it, and I was working with another colleague there at the San Antonio Express News, reporting on it, and really from the perspective of okay, what do readers need to know? At this point, there is no vaccine. We don't know the scientists don't know a lot about it. This is what the CDC is saying. This is what the federal government's saying. This is what our state governor is saying. And sort of let readers try to figure it out, like what, try to our best to sort of help them understand this situation, and how important it is, and how it could be a danger to them. So that was sort of early on. But I remember we were in our old newsroom offices in downtown San Antonio, and it was like they were trying to figure out, they didn't want everybody in the newsroom at the same time, everybody in the building at the same time, because they wanted less people. And so they were like, okay, you're Tuesday, Thursday, you're Monday, Wednesday. Like, it was just very interesting, because I didn't even have a laptop. I had a desktop computer at that time, because my boss was very old school, and he wanted to see us there. And so I had to actually get one assigned to me, a laptop, so that I can work from home, so working from home wasn't even a thought really at that time. And very quickly we were all home working, we were all sent home.
Yeah, there's so many points that you hit that I want to circle back to that are all so poignant, I think. But the first, I think, is just workflow wise, like how did that change? I know you mentioned like less people in the office working on a laptop, but how do you feel like that changed doing your job and being able to do your job? Because you mentioned that you were in a more traditional place, and now like the news is more important than ever, right? Because this is such a hot topic, and like you said, you're trying to communicate all this information to your readers, but then sort of behind the curtain, the way that you do your job has changed instrumentally. So how did you sort of navigate that? And what was that like for you when you were first starting to have to continue to do that under these new circumstances?
I would say that it was, in a way, it was kind of exciting, because as a journalist, breaking news is exciting, right? Like we thrive on that, deadlines, and trying to get it right, and as accurate as we can, as fast as we can. So there was a part of me that was excited, and then there was another part of me that was nervous, because I've been covering healthcare for a long time, and so had my colleague. But that does not mean that our editors and the other people that are touching our stories, and that are all the hands that need to touch it before it gets to print, know anything about transmission of diseases. I mean, and so or even like what, even style wise, like what the CDC, what their actual name is. And I remember having a conversation with an editor, but well, why is it CDC? Why isn't it where's the P, right? Because Centers for Disease Control and Prevention. I'm like, just trust me. This is this is the right thing. But it, just those sort of things where it's like all of a sudden people that had never had any really any interaction or working with the medical side, with doctors, with scientists, with these sort of academic papers that started coming out, the research that was coming out really early, they're trying to, is this important or is this not important? And it's one of those things where it's like, well, you're trying to, it's like, yes, but yeah, you can't just take every single academic paper as this is, it's just too early. And so it was just going through that was, I think, it was stressful, and it felt like there were people all over the newsroom that were covering this story in different ways, and they're contacting me, and is this right, is this the way that I should refer to it, can you read this real quick before I send it, and so it was like an extra layer of responsibility, I think, that I had at that moment.
Yeah, 100%. So like information, I feel like you touched on it already, was such a pivotal thing during the pandemic, especially that first year, just because, like you mentioned at the beginning, like there is no information, we don't know anything. And then when people do say something, because of differing interests, you don't know what's true or if something's opinion based, or, if what Anthony Fauci is saying is different from what the CDC or the state government is saying. So, with that responsibility, um, how did you decide what to sort of believe and what to use as your basis for reporting? Because even in the academic space, like you said, there are so many different papers, like that, I can't imagine the difficulty of making that decision. But how did you say, okay, this is what we're going to consider credible and base our reporting off of, and then distribute that to the rest of your team?
Some of it, I think, was just the experience of having done this kind of reporting and being in this field before. So I know that when doctors and scientists are talking about something in a certain way, they're careful on the words that they're choosing for a reason, right? And so I can pick up on that and be like, okay, so what you're saying is, and I have to translate that into layman's terms for real people, right? Like, so what you're saying is that we just don't really know that yet, or it's possible, but it's not a for sure thing. And so I feel like, one, it was the experience, but then also it was just doing that extra work of not just trusting us one or two sources, right? Like, just because the governor is saying it does not mean, or the state is saying it does not mean that it could be fully, we had to vet everything, and we had to, sometimes we didn't know, so we would just say, this is what the CDC is saying, this is what the state health department is saying, and this is what scientists locally are saying, and so, and throw that all out there, put the appropriate context, and that way the reader can decide, because that was the truth of what was going on at that moment, is that there were so many people that were saying conflicting things, and I I didn't want to omit anything, right? Like, that was going on, because then it would look like I'm, trying to steer the conversation in a certain way. But it was very difficult, because there were early on so many people, that the anti-vaxxers, and it's like, that this is obviously not, this is not true, or this is, they're taking this data out of context, and that to be, I mean, I had a case a couple years before the COVID, where I was reporting on it was a Munchausen syndrome by proxy case, in which a mother was accused of making her baby sick, but she was blaming it on that her baby had gotten a vaccine that was meant for the sibling, right? Like, so they like mixed up the shots, and so she got it. It was, like I was going down the rabbit hole, and so I have a lot of experience with that sort of, I guess, um those sources, and knew how to sort of navigate those situations. But it was frustrating, because you're like, what was the most, I think, interesting is that as time went by during the pandemic, is that there appeared to be doctors that you would normally trust, that started veering into into some of these theories. And it was like, wait a minute, like you went to Harvard, you went, I mean, you know what I mean? Like it looks like we should trust you. You know what I mean? Like 6 months ago, I would have quoted you in a story and been like, this is a legit source. And then now I'm like, I see the things that you're tweeting. I see some of the things that you're saying on TV. And it just, I don't know. That was very tough, I think.
I can't imagine. And that's such a great segue because I feel like trust was another big topic of discussion, I think, just in the way we were communicating COVID, as the media, and then as the way it was being received. So you mentioned like sources that you would have considered without a shadow of a doubt credible maybe 6 months before because of their resume and because on paper it seems like they have all the trimmings of someone who should know what they're talking about. But now you have sort of skepticism, like being the news, the people trust you all. So did you experience similar skepticism from your readers and from the people who sort of consumed what you were putting out, similar to what you were experiencing with those doctors? Like, was there any pushback or
Oh, yeah,
conflict during that time as well, especially as the pandemic sort of carried on throughout the year?
absolutely. I think working also for a daily newspaper, um, in San Antonio, whenever we were doing stories, it wasn't just let's quote what the officials are saying. We wanted to talk to real people and what they thought about it and how they were preparing. And so there were times where I'm like going and talking to, man on the street interviews, just trying to talk to regular people. And they're like, COVID, nope, they don't even want to like touch it. They don't want to be quoted. They don't want to, and so it it was, that was, I think, tough. And we would get people that would question, where do we find this, how do we, and that's fine, like, because everything that I'm putting out, I've vetted, I've researched, I'm confident in what I'm putting out there, that this is to be true as much as I can know it to be, right? And so I'm like, let me send you my sources, let me send you this link, let me send you, and or I will engage with the public in that way. And so for me, that was I was very comfortable doing that. And I think it helped when I was doing my project, where it was more than just like a daily story. It was more research and in-depth reporting. Was, I could sit in people's living room and talk to them and understand like what they're going through, and they see my face, I look like them. A lot of times I'm going into these communities where, I'm Latina, I also grew up in this side of town, I understand the different challenges that you have. And so I feel like that helped a lot with trust, because it was like they wanted to trust me, right? Because of like the way I look, because of the way that I interact with them. And so that was great. And a lot of times it felt like I was like, okay, well, this is what the doctors are saying, this is what the officials are saying, and I'm like literally translating this to so that regular people could understand it.
100%. And I think, so you mentioned building off of that, and then even going back to, for instance, I think your story at the mall, like you got a unique opportunity as a news gatherer to sort of see this at eye level. Like you mentioned, the woman on the street sort of example. Like, I'm curious what you saw from the community of San Antonio during that time, just from maybe their emotions, how they were processing COVID, how over time people's belief or disbelief about the virus or the vaccine, even, or the measures that the state was taking, whether it be lockdowns or mask mandates. Like, from a community standpoint, having that eye level view, what are some of the things that you took away from that, from those people?
I think I think for another sort of thing to consider is that I live here in San Antonio and I'm reporting on a community that I'm a part of. So the same kind of fear and insecurities and doubts that they may be experiencing with the shutdowns of things, with going to the grocery store, trying to find cloth masks, on Facebook, trying to get child-sized cloth masks early on when they were not available in stores. All those kind of things. I was also, me and my family, we were going through it as well. So I feel like that I'm seeing, and I'm trying to report on what I'm also seeing like in my own family and what I'm also feeling. So it wasn't like sometimes in journalism, when something big happens, you see these sort of parachute journalists come in from out of state, from a different community, and they may not understand really the nuances and of the culture of the folks that live here. And so being part of this community, I felt like I was like, I could commiserate with them, and I understand. And so that, I think that at that time, everybody was just really scared, especially with not just like the regular folks, regular people, but at that time it was like essential workers. And it was like folks who, they had to work, they had to go to work, and they didn't have a lot of times the proper equipment to protect themselves. But they didn't really know, because at that time none of us really, we didn't know. And I my partner, he works at a very busy restaurant. And so he, at first it was like, well, you better get to work. We have, this restaurant has to stay open. And then quickly, when things started shutting down, um now he's out of work. So as much as some of the sources and the folks that I'm reporting on are also out of work, so was my own family. And having to deal with trying to get those COVID benefits that came out and filling out that paperwork, the unemployment and all that stuff, or underemployment. And so, yeah, I think it was such a crazy time there for everybody.
Yeah, you mentioned it's a crazy time, and I thought it was a great point to bring up that you reside within the community that you were reporting on, right? So it sounds like that sort of affected the way that you reported the news as well, right? Whether it was just tone or sort of keeping in mind the emotional standpoint and piece of everything when you communicate that back to people. Would you say that that was a big factor in sort of how you went about your job during that time because you were ingrained in that community?
Absolutely. Yeah, no, absolutely. I think that's something that I always try to keep in mind with my reporting, but it became a lot more important or crucial during COVID. I remember, um, you know, I would have editors that would sort of be like, well, we don't really need to put all that in this story. And I'm like, you were assuming that people read the first 5 stories or they have a subscription, or this is not the first article that they're coming across. It may be. So we have to provide all of this sort of important context if this is that one story that they end up clicking on, if this is the one paper they end up picking up. And so because that's a reality of people in the community they're so busy, especially during COVID. Their income is threatened, whether they're gonna be able to provide for their families. And at that time, it was just like the food bank lines were just insane. And so they're not reading every single article, especially if it's behind a paywall, which was the case with a lot of our content. So we did end up lifting that paywall, I believe, on some of the breaking news, the really important ones. But it was still, if the readers are used to not being able to access that and they click on it and they can't read it, they're not going to click on it again. They're trained to like, oh, I'm not going to pay for that. And so it was really important that we sort of we were just trying everything to reach people and to make sure that when they do come in contact with our work, it was it had all the vital information that they needed. So I remember when the vaccine started coming out, when that information was coming out, it was like, this is important. We need to put in every single article that it's free. We need to put that it's approved by this, that because you can't assume that people know that it's free, especially if they are don't normally have health insurance, which a lot of our population doesn't. You cannot just assume that they're like, oh, I'll just go to the pharmacy. You're not going to do that, especially if you don't even go to the doctor normally, right? And so I think it was just understanding what the audience, the people in our community are dealing with, and how they would be, how receptive they would be to what they're reading.
No, 100%, especially because you might be the only person that they trust to even read everything. So I think over communicating the details definitely seems like it would be the way to go. Because I think the same way that you said you sort of can't assume that they've read the first five articles, I think there was also an assumption that everyone was sort of reading and listening to everything and then building a collective knowledge. But I can think about in my own personal family, my elderly family members were maybe only looking to the one, local ABC channel that they normally watch, and that's where they were getting everything. So if there was misinformation or poor information or no information, there was a gap for them. So I imagine that affected how you were all doing your job as well. That's a great point. So yeah, one question I did want to sort of go back to. So you mentioned, I think, having the unique perspective of reporting on it within, the community in which you live, like just from a personal standpoint, I think in the workforce especially, I feel like there was a big push to sort of just focus on your job and disassociate from everything else, focus on it later. But I feel like that was getting harder to collectively do. So I'm curious, like from a personal standpoint, how did you balance what you were feeling, when you closed the laptop or came in from the street at the end of the day, with having to do your job? How did you separate, your personal feelings, worries, anxieties, angsts, with, what you were sort of experiencing in the workplace? Was it even possible to separate those two? Did it bleed over? I would love to hear some more about that.
It was it was extremely difficult, but I think that it in a way it helped my reporting, in that I knew just how freaking important every word that I'm choosing to put in this article is, right? Um, because people are relying on that information for whether or not to, on how to protect themselves against this virus. And so if I could help that, like, it was super important. I remember, I'm thinking of this one week where I was assigned to write a story about this older man who, he was not vaccinated and the family didn't push him. And he had worked at Church's Chicken for decades, and he was in commercials, and he was just like, everybody loved this man, and he was just, he had lots of grandkids, and he was just this sort of just wonderful man. And he ended up getting COVID and dying from it. And his family allowed us to go to his funeral and to talk to them and to share part of his life. So that was, I believe it was on a Friday. And 2 days earlier, I was at a funeral for one of my really good friends. She lost her husband. And so it was just one of those weeks where it's like, any week where you have to go to more than one funeral is, I think, already just like kind of overwhelming. But um in this case, it was like my friend's husband who had passed. She didn't push it in for him to get, she let it be up to him whether he wanted to get vaccinated, and he didn't get vaccinated against COVID, and he ended up getting sick. He went into the hospital, but he eventually he died from it. And we're talking, he was in his mid-30s. He's a former Marine. He's super healthy, has a very young son, beautiful family. And I knew them, I knew that family. And so it was to see her go through this incredible loss, becoming a widow at our age, and just experiencing that. And then also covering it for work. So there was like, at one point it was like, here's my personal life that I'm going to this funeral, and then, okay, like now I'm doing this for work, let me put on my reporting hat and be taking notes. And it was just such a surreal, just weird feeling. um and I remember I'm coming home from that second funeral that week, and my sister had called, and she was, everybody's in their own thing, and I remember she um she was like, oh yeah, well, just kind of polite, like, yeah, what's going on with you? And I try to explain to her, like, this is what's going on with me. And it was like, yeah, okay, whatever. Yeah, I'm super busy too. And it just felt like, um, what? Like I'm trying to explain to you, like, this is like a terrible time and this is super serious. And my sister actually was very resistant to getting the vaccine as well, which for me was just as a healthcare reporter and as being so close and talking to doctors about how this works and how this will help and it'll protect you, it was so hard to sort of hear that. And I'm like, I literally just came from a funeral where this family lost this wonderful human being because he, and or it's possible because he wasn't vaccinated, his, and it was because of this virus. And so um it was it was very hard at times, but it was also all those experiences. I think the personal experiences and interacting with folks is like, it just made it so much more important to try to get the truth out there, to try to get the reporting. And maybe they're not going to hear it, they're not going to they're not going to want to absorb that information, but I'm going to keep trying.
No, 100%. I think that's got to be the hardest line to toe, right? Of like separating what you're feeling, and understanding that even though it hits so close, it hits so close to home for you personally in your personal life, that in your work life, when you see people sort of maybe not taking it as seriously, or even when the vaccines were rolled out in the San Antonio area, not going, like I can't imagine. I'm sure it was just like a fire burning inside of you to communicate to those people, like, hi, I'm not just a reporter, I'm Laura from down the street, and I'm really telling you, like, this is really serious and I need you to understand that. Like, that's it was one of the
It's
hardest jobs I imagined to do during that time.
and it's so hard because it's like, you're, as a journalist, you're not supposed to be like an advocate for something, right? But then you see so much evidence and so much, you see, and then you go into the hospitals and you see people literally dying from after contracting this virus, and their bodies are struggling to survive, and you see the toll that it has on the faces of and the hearts of like these healthcare workers, which I remember early on. This is incredible, but early on when the vaccines first rolled out, I remember it was around Christmas, around early January, Christmas time. A lot of those nurses in the emergency rooms even did not have access to the vaccine themselves. So they're the first ones that would be, they're front line, and not all of them had access to being able to get that vaccine early and protect themselves. And at the same time, they were struggling with having enough masks, and other equipment to PPE to be able to do their job and not risk you know exposure in their lives and bringing that virus home to their family. And it was just yeah, it was wild.
I cannot imagine. I cannot imagine. And I feel like just from a national news standpoint, you can sort of see, because I do think we got to kind of get that, whip pan of like, this is happening in Boston, this is happening in Louisiana, this is happening in Texas. And even though we're in such different places and the governments were approaching them differently, I feel like you could see that the impact on the people was still the same, like from state to state, city to city, where there are a ton of cases like what you just mentioned, where frontline workers can't get vaccines. And I just remember personally seeing and thinking to myself, like, we all can't seem to agree on this from state to state, but I can see that there's like great pain and loss, I think, across the board. Which, like you mentioned, having to be objective as a journalist, like that must have been the hardest part of the job. Because even I'm curious, so when they rolled out the vaccines in San Antonio, like, what was the Texas Tribune sort of approach to communicating that information? Because obviously there's anti-vaccination parties and then people who were pro-vaccine. Like, did you just sort of take the approach of this is the information, this is where it is, and call this number if you need more help? Like, I'm curious how you guys decided to roll out that information.
So at the time I was at the San Antonio Express News, I wasn't at the Texas Tribune yet,
All right, yeah.
but uh, but we just tried to we tried our best to be as clear and concise as we could. We put it on the front page. We made sure that we had photographer there too. Tried to make sure it wasn't behind the paywall. That we were pushing it on social media. Like there was just really this big push on telling this story of like, hey, this is out. This is rolling out right now. This is what this means. This is when you can get it. And this is why doctors and scientists are saying you should get the vaccine. And so, yeah, I mean, it was all, this was the first time that we really dealt with the public health disaster of this magnitude, right, as reporters. And so we're used to breaking news, we're used to, natural disasters and hurricanes, I mean, like covering these sort of things, and unfortunately like mass shootings, this kind of thing. So there's a sort of playbook, right, like where we think of like, here's our guidelines of how we want to cover this, right, on how we'll do staffing and how we want to do this. But for COVID, we there wasn't, and so a lot, it was a lot of on the fly, and a lot of try to there was a lot of relying, I think, on like our healthcare reporters and on the people that had that knowledge, that were able to help make those decisions on the kind of stories and that we wanted to put out at certain times, and how it would be accessible to people. We knew that Sunday was our biggest that's our biggest our the most readers are going to be reading the Sunday paper, right? And so we knew that if we're going to have a big story on it, we're going to run it on Sunday, and so it was those sort of decisions, because that would reach the most amount of people in our community. And so yeah, it was we were just trying to figure it out best we could, based on, we didn't even know when things were coming a lot of times, even being so well sourced. What we came to find out was that the officials didn't even know what was coming or when it was coming, and so it was very, yeah.
Well, recording or no recording, I can tell you personally, you did an excellent job. I was living in New Braunfels in 2020, sort of when all this was rolling out, and most of my extended family lives in San Antonio. So that's why I was just really excited to be able to, I think, get to speak with you specifically because I was a part of the community that you're addressing. And I can say, without a shadow of a doubt, I think you all did an amazing job. So recording or no recording, I will say thank you, because
Thank
you,
you.
I can tell you, like I was there. I was among the audience that you reached, and in a a media landscape that was just absolutely crazy during that time, especially when you talk about like who can I trust, like as and
Yeah.
for someone like me, it's like in my community, in my racial community, especially, and having a lot of older family members in that area, like a lot of people were looking to me for information. So it's like, your ears are on the ground. Like, what are they saying? And it's like, I don't know who to listen to or trust. So I think you all were who I kind of was like, well, I trust that this is, you've proven that this is it's credible information, it's objective reporting, but I still feel like these are human beings communicating this, like this is a human issue. And I feel like that's all you could really ask for during that time. So thank you very much.
I feel like just even my byline though helped on getting that, and me being out on this in the field, and them seeing me kind of, that I'm the one that's doing these reporting, that I felt like that was helpful in trying to get these stories out there. Because the thing is that as people of color, as Black and Hispanic folks, they have, especially older folks, they have a very deep mistrust of the medical community for good reason, like you think about the Tuskegee, like the syphilis sort of trials, and you see how Mexican women were sterilized, so they wouldn't have any more babies. And this happened in our country, right? And so it was just, it's like, it was so important to make sure that the information that we were getting out there, that we could really we could stand by it. I could say, I talked to a doctor and he's, this is what he told me. And I looked up this, and this is what, this is what we're seeing. This is what the experts believe to be true, and how it is affecting people, and how this would help people. And so it, I think that it's like, considering the source of like where things are coming from, sometimes it was just like that that face that's out there, that's communicating this. I remember there was this, and journalism has long had like it's a white man's, industry, right? And so there's slowly been change, and I'm an advocate for more people of color, women of color in the newsroom, making these decisions, and being on the front page, and getting their bylines in there. But I remember that they did a sort of a Zoom on our newspaper outlet. They did a Zoom with like reporters that are reporting on COVID, right? And it was with the editor, who of course is an older white man. And everybody that they had selected to be a part of that panel, they were all white. And I'm watching this, right? And I'm looking at the comments as they're coming in from our readers. And one of them was like, y'all only have white people. It's just like the audience is seeing this and taking notice that this is who you selected, and what was so interesting is that I remember one of my colleagues is really, she's such a good ally. She's a white woman, but she, there were times when the editor was saying, oh, and you did that really great reporting on this and this. And she was like, actually, that was my colleague, Laura. She did that. So she was like making sure to prop me up a little bit. But it was so interesting, because it was like seeing the commenting on from our audience. They notice it. They are taking notice of what we're putting out there, and who's telling these stories, right? And so, and that's helping them determine on whether they want to trust it, or if they can relate, and if that's something that they want to consume.
No, 100%. And I think like outside of even, I'm curious, outside of even the pandemic specifically, like, now still being in the San Antonio community, do you feel like that helps to really build trust between the medical community and the news media and reporting community and the people of San Antonio? Like, because you all had to rely on each other so closely, them relying on you for the information you were giving them and trusting them, and then you rely on them just to sort of keep you sane as a person, right, and to keep you
Yeah.
emotionally grounded. Like, do you feel like that's lasted even when reporting other stories or other types of cases now, as we are near the end of 2023? I'm curious.
Oh, absolutely. Yeah. No, I think that it was just sort of, it was always important, right, to have sort of diverse voices, and people of color being able to be storytellers, right, in journalism for our community, especially particularly for the San Antonio community, because we are majority Latino, right? So and at the time, gosh, we only had in our newsroom, I want to say we only had two Black reporters. I mean, it's just, come on, like there is a also a, I don't know what the percentage is, but I mean, there's definitely a Black population, and it's like it. I think that a lot of, it's so interesting, because it's like COVID happened, but at the same time George Floyd happened, right? Very shortly after. And so you have these sort of major events that are happening nationally, that are affecting, locally, because at the same time we're worried about COVID, we're wearing our masks, we're trying to stay safe, but then we're covering these protests, worried about being injured in these, we're buying helmets, and we're trying to, as journalists, we're trying to figure out how to tell these stories and stay safe. And it was so interesting, because as that's coming out, there is also this sort of movement toward people are like, we're not going to be as accepting as what the status quo is in terms of just what the officials say. We're going to trust it, because as we saw with what was going on with the police, and what they initially were reporting, it it did not jive with what the video showed, right, with what we all saw. And so um there was just this momentum, I think, with society and people at that time, where it was just like, I think it in a lot of ways it made our role as journalists so much more important, because we can't just say, oh well, the cops said this, and this is what happened, and then not do any reporting. Like, you know what I mean? Like, no, you have to go and interview people and find out. You cannot just rely on that one single source because the cops said, because we already know that it's not always true.
So true. And we didn't even get into like how that year sort of just continually spiraled out of control from a news gathering standpoint, because you mentioned protests. That's so, COVID, we'll call it March, like that's when that sort of enters the frame. I think the summer is the George Floyd incident, and then the election is in November of that year.
Mhm.
And I remember going to vote and being caught in the middle of what was just like a Venn diagram of like hordes of people protesting like masks and COVID and vaccinations, but also marching for Black Lives Matter, and then also like Trump and Biden camps. And I was just like, this is chaos. So
Yeah.
it's so intense. And like for me, like just as someone going to vote, I remember being like, I probably need a helmet. Like I feel unsafe. So I'm curious, like having to report on healthcare during that time, like was there ever a time where you experienced conflict or that you can remember where maybe you felt in danger, or what was the climate of San Antonio specifically in comparison to maybe what we were seeing on the news, like in Kenosha, for example, where it's maybe a little more extreme? Like I'm just curious.
So our newsroom definitely recovering extensively covering the protests. But I remember I had, they sort of, when you on the news team, they sort of rotate weekend shifts. So I had a random Sunday shift come up, and there was a protest that day. And so, but it's a Sunday, so I'm the only reporter on. And on the weekends we didn't have our staff photographers, so we had like a freelancer, right? So I don't even know who the photographer is. I wouldn't even like recognize them, right? And so it was it was an interesting experience, because had I been covering a protest during the week, or at 2 days earlier, there would have been 4 different reporters there, all coordinating with each other. The editor is right there in the newsroom. You would have at least one photographer, everybody sort of on the same page, or making sure that they're looking out for each other. And so having to cover that on that day, it felt like a solo sort of situation where I was just like, oh my God, like, I can barely reach my editor. I don't know where the photographer is. I don't know who the photographer is. And it's a protest, and it was one of those, like, it was like a skateboarding, I cannot remember what it was, but it was like we were going from one area to another. And so I'm like, okay, I have to park here and then walk this long distance downtown, by myself, and trying to keep up and like interview people at the same time. And then when I get there, I was like, I'm definitely getting an Uber back to my car. Because at that point it was dark. It was dark. You're in downtown San Antonio. I'm by myself, and I was like, okay, yeah. So that was, and just a few days earlier, they had like, I had coworkers that were, I don't know what the word is, but it's not tear gas, right? But it's like, the chemicals or whatever that they had to pour milk in their eyes. And I mean, you know what I mean? Like another one, he got shot with one of those little beanbag gun things, and he had these huge bruises on his leg. I mean, so I'm saying, like, because of the police presence that was there. And so that was always like it was scary. At that time, it was like the police were trying to protect the property from getting, it was just this crazy time. And so there was like, I'm sort of scared of this, getting in the middle of what may be a situation with people, with protesters and the police, and I don't have that support that I normally would in the newsroom because it was a Sunday. So yeah, it was.
I can,
And oh my gosh, and so it was so hot that day too. This is, well, let's put it on the record. It was so hot, and so I finally get back to my car, and I get in touch with the weekend editor, and she was like, "Are you okay?" Blah blah blah. And I was like, "I don't feel good. I'll call you back." Throw up because it was so hot. You know what I mean? And I was like dehydrated. And then I was like, all right, I called her back. All right, I'm good. I'm good. I'm writing the story from my car on the on my phone, emailing it to her. But I was like, oh my God.
yeah, that's like a
Okay.
total overload, I'm sure, because it's hot and you're also stressed and you're by yourself. So I feel like I would have thrown up probably an hour earlier than you did. So shout out to you for holding out as long as you did.
But I think,
Um,
um, there's also times where I was in the hospitals, uh, you know, with COVID patients and such. But I didn't feel, I felt like the healthcare personnel that were there, if I have the same kind of PPE and the same kind of like stuff that they have, I feel like, they're putting themselves on the line in that way, like I'll be okay. So that to me wasn't as scary.
true, super valid. Wow, I feel like we've covered so much that is, uh, I could talk for 2 hours about this. I think especially because I was in San Antonio in the
Yes.
area at this time, that I feel like I remember the North Star Mall like thing. Like so, like, it's just funny to be able to hear it from your
From the
perspective.
other side, yeah,
Yeah,
like
'cause I
I'm
heard
like,
about
you
it
want me to
from
go where?
it's so funny hearing you go there because I heard about it from you, and I was like, "This is what's
Yeah.
happening." So, yeah. But I think
Your
one more
stories.
thing that I'm kind of curious about. So, obviously, you'd mentioned that your time and your excellent coverage of this at the Express News led to where you are now. I'm curious, like, just looking back at that experience as a whole experience. What did you sort of take out of that? Because you mentioned there was no playbook for how you handled that. There was no you're not seen like a public health crisis like that, at least in the San Antonio area, in a long time. So like, you having to overcome that adversity, having to sort of work on the fly, make adjustments, balance the personal and work life. Like, what are some of those things that you took from that post that you apply now with your time at the Texas Tribune?
I think that for me it was just I think just seeing like, you can get so busy, so bogged down doing the daily stories, this is how many cases we have, this is how many, how many are hospitalized, and it's busy work. It keeps you busy, but there's so much importance in that background story of, like we were talking about the vaccine rollout and how it reached different healthcare facilities and didn't reach all of them, right? And why? And so what I'm finding out through reporting and through spending a lot of time on it and talking to so many people, what I was finding out was that early on, you remember that there had to be certain the vaccines had to be held in certain freezers, right? They had to be in a certain temperature and it had to be big enough for these doses, and not all of our hospitals were equipped for that. And so that's why they were not, necessarily allocated those doses. And so come to find out that when the other hospitals, and these are competitors, right? These are not the same hospital system at all, but these are when other hospital officials found out about this, they offered those frontline nurses to go get vaccinated with their doses over at their hospital. So you're finding out about all these sort of like workarounds and the way that people in our community were trying to protect themselves, right? And so like, okay, this is not going to work. Like it was just incredible. There was, it happened that hospital that was not equipped with it. It was a privately owned hospital. It was on the south side, one of the only ones on the south side, which is where there's just immense sort of health disparities, and it's more there's more poverty and in that area, and so there was just sort of all these compounding sort of things. But what was incredible about like the reporting and being able to do that is that spending the time to find out these backstories of like what was really going on when this happened, when we were all hearing about this, what was what did you do in that instance, and how did you sort of navigate or mitigate that sort of situation. And it was so incredible to hear like the way that our city council members, certain city council members, certain city officials were working together to try to make sure that their districts were protected or covered. I remember in my story there was a city councilwoman, I think it was a city councilwoman, she knew that her community needed information in Spanish, and they needed it in a certain way. I think it was, I don't remember if it was like if it was like the direct phone calls or what, but they didn't want to give her the funding for it. And she was like, whatever, I'm just using my budget then, my district budget, and we'll figure it out later, you know? And that's what they did, because it was like, she felt at that moment, this was so important that we get this information out to the people. And so being able to hear about those stories and share that with the community, I think that that was just, it was so important. I think that it was also just, that's something that like it taught me also to be like more confident in my reporting and holding my sort of ground. Like I did the work, you know what I mean? Like I found this out, and we're going to report it. And this is what we're going to put out there. And, and I feel like as an editor now that I'm at the Texas Tribune, I am able to support my reporters in a way that I didn't always get supported, you know? So if there's a reporter that's been covering the CDC for 8 years and I'm asking, why isn't there a P in there? No, I'm not going to do that. I'm going to trust that they probably know what the entity is called. I don't know. I feel like it's made me a better editor and a better reporter and a journalist is going through all those experiences. And as a reporter, and now I can I have a different perspective where I can be a different kind of boss. And I think the biggest thing for me is like with all this stuff that we were going through is when I was accepting this job, one was like I wanted to stay in San Antonio because this is my community and this is what's important to me. But two, I just really wanted to have a seat at the table and be part of the decision making on how our resources are allocated, what kind of stories are making it to that front page, where we're sending our reporters, what stories are important, and so that was something I didn't always, or I was butting against, I didn't always have at my old outlet. So now I have a lot more say.
And that's the beauty of it, right? I think when things are working how they're supposed to work, that's how it should go. It's like, it wasn't like this for me when I was doing this. And so then there's a decision, well, am I just gonna be that same way because that's how it was for me, or am I going to change it for the person coming after me and make their life a little bit easier? And then when that person pays it forward, I think things tend to run a little smoother and be just a more enjoyable experience for people. So yeah, it's no shock to hear that you've taken those sort of lessons with you to where you are now, because I think the excellent work has continued at the Tribune. So thank you so much for your just service during that time, because it truly was a time where a lot of people walked away from journalism. Like I think the weight, I had sort of worked in that community prior to being in this PhD program, and a lot of my colleagues they just left. They just walked away from the desk. They couldn't take it.
Well, I don't blame it. I don't blame them. Yeah.
Yeah, it was a crazy time, but yeah, I think I don't have anything else. Is there anything else you would like to add?
No, I appreciate you listening to me, and I'm sorry for going off on tangents. And
No, this is not tangents. This is oral history. This is
oral
the
history.
record of a pivotal time in our country. So no, please, it was I got so much great stuff. And thank you for your participation. Seriously.
Thank you.